Hi, I'm Dr. Shruti Tannen. I'm a board-certified plastic surgeon. Today, I want to talk about facelift, neck lift for facial aging versus doing less invasive things like lasers or microneedling. How do you figure out what it is that will help you? So, a part of it is knowing yourself. Like if you've done things throughout your life that will advance your skin aging or make your skin aging be faster than your peers, then be honest with yourself and realize that you're going to have to do something for your skin. So, what are examples of that? Number one, smoking. So, if you smoked for or vaped for a substantial period of your life, then you can expect to probably need some type of skin resurfacing. And by that, I mean like laser um, treatment to your face to address those top layers of skin. Or if you grew up with a lot of sun exposure and not very much sun protection. And so, if you were going in a tanning bed, or if you grew up and were out on a farm or out on the boat like every single day. These are examples of people who had like decades of sun exposure. They're going to have accelerated skin aging compared to someone else who's their peer who didn't have that. Okay, so know yourself, because if that's you, if you're in that camp, then you'll definitely need something for your skin, plus or minus something for the deeper layers like a face or neck lift. I think the key is to look right here on your face. So when you start to notice the skin fall down here, and you notice this is your jowl. So when you notice like soft tissue hanging on the side of your kind of where your lips turn down around your chin, those, if you notice tissue hanging down here, those are called jowls. And filler is not going to make that go away. You can't expect it to go away with. So if you think about the crease that separates your chin from your cheeks, especially along your jawline, there's one little place right here where we have a point of adhesion. And your skin and soft tissues can fall down next to it. That space right here is called the jowl. And if you notice, now all of us have loose skin, right? Like I can pull my skin here. My 8-year-old son, I can pull his skin. So he doesn't need, like a tummy tuck just because he has loose skin that I can pull. That's not the way it goes. But if you have skin that at rest, when you're talking to someone, has like hangs down, then that's the type of person that laser, microneedling, that's not going to fix that. That needs a face and neck lift to correct it. Now, does everyone who has jowls need a face and neck lift? Absolutely not. I'm talking about indications for a particular procedure. So if this is something that bothers you and you want to look into how can I make it better, how can I make it go away, the answer to that is not non-invasive, minimally invasive stuff. Because if you have this amount of tissue hanging and we start putting filler in, that's when you run into these issues where people look over full. Follow us for more. Let me know if you have questions. This is a pretty complex topic, so it's hard to unpack in a 1-minute video. So I'll be putting some more information out there, but I'd love to know what you want to know specifically.